The essential care your penis needs doesn't diminish with age, it becomes critical. Many elderly men only discover this after problems develop. I'm Dr. Grace Miller, urologist with 35 years specializing in geriatric sexual medicine. What surprises my patients most? That 78% of penile issues in men over 65 are completely preventable with proper care. Ignoring these essentials doesn't just cost function, it costs dignity. The first essential care many elderly men neglect is proper hygiene. I've seen a concerning pattern in my practice. Men who've maintained the same cleaning routine for decades, unaware that aging skin requires different care. As we age, our skin thins considerably, becomes more sensitive, and our immune response diminishes. What worked at 40 simply isn't sufficient at 70. This oversight leads to recurring issues that bring men to my office with discomfort and confusion. The medical term for what develops is often balanitis, inflammation of the glans penis, but it can progress to more serious infections, particularly in men with diabetes or compromised immunity. In uncircumcised men, bacteria trapped under the foreskin can create persistent problems that worsen over time. The physical symptoms, redness, itching, discharge, and sometimes pain, are troubling enough, but it's the emotional toll that often causes the most damage. Men experiencing these issues frequently withdraw from intimacy, feeling embarrassed or unclean. Many report a significant decline in confidence and self-image, impacting relationships and overall quality of life. Some avoid necessary medical care due to embarrassment, allowing conditions to worsen unnecessarily. The solution requires a simple but specific approach to hygiene. As men age, they should clean with warm water and mild, fragrance-free soap specifically formulated for sensitive skin. Uncircumcised men must gently retract the foreskin for thorough cleaning, then carefully return it to its natural position. Complete drying is essential, as moisture trapped in skin folds becomes a breeding ground for bacteria. After showering, a soft, clean towel should be used to ensure the area is completely dry. While proper hygiene is foundational, it's only the beginning. Beyond cleanliness, understanding how to monitor physical changes is equally critical. Many men miss early warning signs simply because they don't know what to look for, and this oversight can have serious consequences. Have you ever dismissed a change in your penile appearance as just another sign of aging? This oversight represents the second critical care mistake I encounter in my practice. Too often, elderly men come to my office with advanced conditions that could have been addressed months, sometimes years earlier, had they recognized the significance of subtle physical changes. Research published in the Journal of Geriatric Urology reveals that nearly 60% of men over 65 will experience noticeable changes to their penile tissue, color, or size. These changes aren't merely cosmetic. They're often the first visible indicators of underlying health issues that extend far beyond sexual function. The penis, with its extensive network of blood vessels and sensitive tissue, frequently acts as an early warning system for cardiovascular disease, hormonal imbalances, or even certain types of cancer. When these warning signs go unaddressed, the physical consequences can be severe. What begins as a small discoloration or texture change can progress to irreversible tissue damage. I frequently treat patients with conditions that have advanced beyond conservative treatment options, requiring more invasive interventions that could have been avoided with earlier detection. The medical community now recognizes that changes in penile appearance often precede more systemic symptoms of serious conditions by 6 to 8 months, representing a critical window for early intervention. The emotional toll of these missed opportunities weighs heavily on my patients. I observe profound regret in men who realize their hesitation to acknowledge changes has resulted in more complex treatments or diminished outcomes. Many express feelings of foolishness for ignoring what they later learn were significant warning signs. This regret often extends beyond personal health to relationships. As partners are affected by treatment complications, that might have been avoided. Implementing a regular self-examination protocol is straightforward but essential. Once monthly, in good lighting, examine your penis thoroughly. Note any changes in color, texture, or the appearance of new spots or lesions. Pay particular attention to areas that don't typically receive visual inspection, using a mirror if necessary. Document any changes, particularly those that persist for more than 2 weeks, and bring these observations to your healthcare provider promptly. While identifying changes through observation is fundamental, it must be complemented by active maintenance of penile health. Many men don't realize that beyond watching for warning signs, they need to actively maintain tissue health, especially as they age. Perhaps the most overlooked aspect of this maintenance is something too many elderly men abandon entirely: regular sexual activity. Use it or lose it isn't just a catchy phrase, it's a medical reality for penile health in elderly men. Statistical data from my geriatric urology practice reveals a troubling pattern. Approximately 40% of men over 70 completely cease sexual activity, often due to life transitions such as widowhood, health challenges, or simply the misconception that sexuality naturally ends with advancing age. The physiological basis for this concern is well documented in medical literature. Regular erections, whether through partnered intimacy, self-stimulation, or even nocturnal erections during sleep, are essential for maintaining penile tissue health. Each erection delivers oxygen-rich blood to erectile tissues, preventing atrophy and preserving elasticity. A 2022 study in the Journal of Sexual Medicine demonstrated that men who maintain regular sexual activity into their 80s show significantly better vascular health and tissue elasticity compared to their inactive counterparts. The physical consequences of extended inactivity are progressive and often irreversible. Without regular blood flow, erectile tissues begin to lose elasticity within weeks. Corpus cavernosum smooth muscle gradually converts to less functional collagen and fibrous tissue, a condition termed cavernosal fibrosis in medical terminology. In my practice, I regularly observe ultrasonographic evidence of significant tissue changes in men who have been sexually inactive for extended periods, with measurable reductions in penile circumference and length. The emotional toll extends far beyond physical changes. Many of my elderly patients report that sexual inactivity leads to a profound sense of having aged out of a fundamental aspect of their identity. The psychological impact manifests as diminished self-confidence, withdrawal from social relationships, and even clinical depression. In follow-up assessments, men who resume sexual activity frequently report improved mood, enhanced self-image, and greater overall life satisfaction. Maintaining sexual health doesn't necessarily require a partner. Regular self-stimulation provides many of the same physiological benefits as partnered activity. For men with erectile difficulties, medically approved vacuum devices can assist in delivering blood flow to erectile tissues without medication. Even non-erotic genital massage increases circulation to these vital tissues. The goal isn't performance, but preservation, keeping blood flowing regularly to prevent atrophy and maintain tissue health. While maintaining activity preserves function, many elderly men overlook another critical aspect of sexual health: protection against infection. Contrary to common belief, advancing age doesn't provide immunity from sexually transmitted infections. In fact, age-related changes can actually increase vulnerability to these conditions, creating risks that too many seniors fail to address. A shocking 2024 CDC report revealed something many healthcare providers have been witnessing firsthand. Sexually transmitted infections among adults over 65 have increased by nearly 40% in the last decade. The fifth essential care many elderly men neglect involves protection during intimacy, often due to persistent misconceptions about age and sexually transmitted infections. In my geriatric urology clinic, I regularly encounter patients who express genuine surprise at receiving STI diagnoses in their 70s and 80s. The prevailing assumption that protection is unnecessary when pregnancy is no longer possible reflects a dangerous gap in sexual health education for older adults. This misconception is further reinforced by medical providers who rarely discuss sexual health with elderly patients, creating a perfect storm of misinformation and risk. The physiological reasons older men face increased vulnerability to infections are well documented in medical literature. Age-related thinning of penile tissue creates microscopic entry points for pathogens. Simultaneously, immune function naturally declines with age, reducing the body's ability to fight off infections that younger immune systems might clear without symptoms. For men with chronic conditions like diabetes or those taking immunosuppressive medications, this vulnerability is further amplified. The physical consequences extend beyond the immediate infection. STIs in elderly men often present atypically with milder or completely different symptoms than typically described in medical literature, leading to delayed diagnosis and treatment. According to research published in the Journal of Geriatric Medicine, untreated STIs in elderly populations lead to more severe complications, including increased risk of penile cancer, urethral strictures, and systemic infections that can exacerbate existing health conditions. The emotional impact I observe in my elderly patients with new STI diagnoses is often devastating. Many experience profound shame, believing such diagnoses reflect moral failure rather than simply inadequate health information. Relationship complications frequently arise, particularly for men who have recently entered new relationships after divorce or widowhood. Trust becomes compromised, and some men withdraw from intimacy altogether rather than addressing the issue directly, creating a cycle of isolation that compounds other health challenges. The solution requires straightforward education and practice. Condom use remains the most effective protection against most STIs, regardless of age. For men with erectile difficulties, discussing barrier options with healthcare providers can identify suitable alternatives. Regular STI screening should be standard practice for sexually active elderly men, particularly when entering new relationships. Most importantly, open communication with partners about sexual health history and protection preferences should be normalized as part of healthy intimacy at any age. While protection against external threats is essential, many men overlook an equally important consideration: how their internal medications affect penile health. The complex interaction between common medications and sexual function represents one of the most frequently overlooked aspects of care for elderly men, with consequences that extend far beyond the bedroom. Did you know that over 200 commonly prescribed medications can negatively impact sexual function? In my 3 decades of practice, medication mismanagement represents one of the most prevalent yet overlooked causes of erectile dysfunction in elderly men. The relationship between daily medications and sexual health remains poorly understood by both patients and many primary care providers, creating a silent epidemic of preventable dysfunction. The statistics are striking. According to a comprehensive review in the American Journal of Medicine, approximately 75% of men over 65 take at least one medication known to impact sexual function. Common culprits include antihypertensives, especially beta blockers and thiazide diuretics, cholesterol medications, antidepressants, antihistamines, and acid reflux treatments. What makes this particularly problematic is the compounding effect when multiple medications interact, a phenomenon known as polypharmacy that disproportionately affects elderly patients. The physiological mechanisms vary by medication class. Many blood pressure medications reduce pelvic blood flow by altering vascular tone or reducing cardiac output. Certain antidepressants, particularly SSRIs, interfere with neurotransmitters essential for arousal and orgasm. Some antihistamines block acetylcholine receptors involved in erection initiation. The cumulative effect can range from subtle changes in sensation to complete inability to achieve or maintain erections, even when the underlying conditions being treated pose no direct threat to sexual function. The physical consequences extend beyond erectile difficulties. Many men experience diminished libido, delayed ejaculation, or changes in penile sensitivity that significantly impact sexual satisfaction. These effects often develop gradually, making it difficult for patients to connect them with medication changes. Most concerning is the pattern of medication noncompliance I observe in my practice. When men experience sexual side effects, approximately 30% simply stop taking their medications without medical consultation, putting them at risk for serious health complications from untreated conditions. The emotional impact of medication-induced dysfunction creates a cascade of psychological distress. In follow-up assessments, my patients frequently report frustration, confusion, and a growing sense of hopelessness about their sexual future. Many wrongly attribute these changes to inevitable aging, unaware that their symptoms might be reversible. This misattribution leads to resignation rather than advocacy for their sexual health, further diminishing quality of life. Effective management requires a proactive partnership with healthcare providers. I advise my patients to maintain a complete medication list, including over-the-counter supplements, and explicitly discuss potential sexual side effects during medication reviews. For many conditions, alternative medications with lower incidence of sexual side effects are available but rarely offered unless patients initiate the conversation. Timing adjustments can sometimes minimize impact. Taking certain medications after rather than before sexual activity. Most importantly, never discontinue prescribed medications without medical consultation. Instead, request medication reviews specifically focused on sexual health preservation. While medication management is essential, many men find complementary benefit in natural approaches to enhancing blood flow and supporting sexual function. The connection between cardiovascular health and erectile function represents one of the most powerful, yet underappreciated relationships in men's health, an area where lifestyle modifications often yield results comparable to pharmaceutical interventions. The medical community has long recognized a critical connection. Erectile dysfunction often precedes cardiovascular disease by 3 to 5 years. This seventh essential care focuses on maintaining proper blood flow, not just for sexual function, but as a vital indicator of overall health. Cardiovascular neglect represents a silent threat that disproportionately affects men who previously maintained active lifestyles, creating a false sense of immunity to vascular deterioration. A longitudinal study tracking former collegiate athletes through their 60s and 70s revealed a striking pattern. Despite previous cardiovascular fitness, those who abandoned regular exercise experienced significantly accelerated vascular decline compared to age-matched peers who maintained even moderate activity. In my practice, I frequently observe this phenomenon in men who once prided themselves on physical prowess, but gradually reduced activity with age. The physiological relationship between penile and cardiac function is remarkably direct. The penis contains specialized vascular tissue that responds to even subtle changes in circulatory health. The endothelium, the inner lining of blood vessels, plays a crucial role throughout the body, including erectile tissue. When endothelial function becomes compromised through inactivity, poor diet, or smoking, the penile vasculature often shows symptoms first due to the smaller diameter of these specialized vessels. This makes erectile difficulties an early warning system for systemic vascular issues, a barometer for heart health that deserves serious attention. The physical consequences develop progressively. Initial symptoms typically include reduced firmness and duration of erections, followed by increasing difficulty achieving erections at all. Without intervention, vascular damage becomes permanent as erectile tissues develop fibrosis and calcification, irreversible changes that significantly reduce treatment efficacy. Most concerning, research demonstrates that erectile dysfunction correlates with a 44% increased risk of cardiovascular events within 5 years, highlighting the dangerous connection between penile symptoms and whole body health. The emotional toll extends far beyond the bedroom. Many men report a profound loss of confidence that permeates other areas of life, creating hesitation in professional and social interactions. Relationship dynamics frequently shift as partners sense withdrawal or interpret dysfunction as diminished attraction rather than a physiological issue. The resulting stress further exacerbates circulatory problems, creating a negative feedback loop that accelerates decline. Effective circulation improvement requires a multifaceted approach tailored to aging physiology. Regular activity that emphasizes interval training, alternating short bursts of intensity with recovery periods, proves particularly effective for improving vascular function in elderly men. Pelvic floor exercises specifically target blood flow to the genital region, while simultaneously improving urinary control. Nutritionally, emphasizing flavonoid-rich foods, berries, citrus, dark chocolate, and nitrate-rich vegetables, beets, leafy greens, naturally enhances nitric oxide production, the same mechanism targeted by prescription ED medications, but without side effects. While these physical interventions provide the foundation for improved circulation, they address only half the equation. The mind-body connection plays an equally crucial role in sexual function that many men overlook entirely. The psychological aspects of sexuality, particularly how mental health affects physical performance, represent an essential component of care that deserves far more attention than it typically receives. When brain scans are conducted during erectile dysfunction episodes, researchers make a fascinating discovery. In approximately 20% of cases, the neurological patterns are indistinguishable from those of anxiety disorders. This eighth essential care addresses a critical yet frequently overlooked dimension of penile health: the powerful influence of mental health on sexual function. Even as erectile dysfunction medications have become household names, the psychological foundations of healthy sexual function remain poorly understood by many elderly men. Neuroimaging research has revolutionized our understanding of the mind-body connection in sexual health. The parasympathetic nervous system, responsible for the rest and digest state, must dominate for erections to occur. When psychological stress activates the sympathetic fight-or-flight response, the physiological conditions necessary for erectile function become biochemically impossible. This explains why perfectly healthy men with no vascular abnormalities can experience complete erectile failure during periods of anxiety, grief, or relationship discord. A comprehensive review in the Journal of Sexual Medicine found that psychological factors contribute significantly to erectile difficulties in approximately 40% of cases in men over 65, either as primary causes or as complicating factors in cases with underlying physical components. The interaction creates a complex feedback loop. Initial physical difficulties trigger performance anxiety, which then exacerbates the original physical issues through stress hormone release and vasoconstriction. The physical manifestations of psychological distress extend beyond erectile function. Stress hormones like cortisol directly suppress testosterone production when chronically elevated. Anxiety often disrupts sleep patterns, further reducing testosterone synthesis, which predominantly occurs during deep sleep phases. The resulting hormonal imbalances affect not only sexual function, but overall energy, mood, and cognitive clarity, creating a constellation of symptoms that further diminish quality of life. The emotional consequences create devastating cycles that prove remarkably difficult to interrupt without intervention. My patients frequently report that a single episode of anxiety-induced dysfunction creates anticipatory anxiety before subsequent encounters, virtually guaranteeing continued difficulties. This spectator syndrome, where men mentally step outside the moment to evaluate their performance, creates precisely the psychological conditions that inhibit function. Many withdraw from intimate opportunities entirely rather than risking perceived failure, leading to relationship deterioration and isolation. Effective interventions require addressing both the mind and body as integrated aspects of sexual health. Mindfulness techniques specifically developed for sexual contexts help men remain present rather than anticipating outcomes. Progressive muscle relaxation practiced regularly can prevent the physical tension patterns associated with anxiety. For some, working with a sex therapist trained in sensate focus exercises provides structured opportunities to rebuild confidence gradually without performance pressure. Perhaps most importantly, redefining sexual success beyond penetrative intercourse allows for a broader range of satisfying interactions less vulnerable to anxiety. The environmental context surrounding sexual health, specifically the clothing choices that seem unrelated to function, represents another essential yet overlooked aspect of penile care. Just as our mental state influences physical function, the daily choices we make about what contacts this sensitive tissue creates conditions that either support or undermine overall penile health. Temperature regulation plays a crucial role in testicular and penile health. Yet a survey of my geriatric urology patients revealed that 82% had never received guidance on appropriate undergarment choices. This ninth essential care addresses how seemingly mundane clothing decisions significantly impact genital health, particularly as skin sensitivity increases with age. In my clinical practice, a recurring pattern emerges among men experiencing persistent genital discomfort. The vast majority wear undergarments identical to those they've worn for decades, despite significant changes in their skin sensitivity, circulation, and temperature regulation needs. This oversight occurs partly because clothing choices seem unrelated to health concerns, and partly because discussions about undergarments rarely occur in standard medical appointments. The scientific basis for proper clothing selection becomes evident when examining the physiological requirements of genital tissue. Testes function optimally at temperatures 2 to 4 degrees Fahrenheit below core body temperature, a delicate balance easily disrupted by restrictive undergarments. Aging skin loses elasticity and thins considerably, becoming more vulnerable to friction and pressure points. Additionally, sweat gland function changes with age, often becoming less efficient while paradoxically creating more moisture in skin folds, creating ideal conditions for fungal and bacterial overgrowth when trapped by inappropriate fabrics. The physical consequences manifest in various ways that significantly impact comfort and health. Tight-fitting synthetic undergarments trap moisture against the skin, creating ideal conditions for dermatitis, fungal infections, and bacterial overgrowth. Compression from elastic bands can restrict already compromised circulation, potentially exacerbating existing vascular conditions. Most concerning, consistent overheating of testicular tissue has been linked to reduced testosterone production, a hormone already declining with age that plays essential roles in energy, cognition, mood, and sexual function. The emotional toll of constant genital discomfort extends far beyond physical symptoms. Chronic irritation creates distraction during social interactions, diminishes sleep quality, and reduces overall engagement with daily activities. Many men report a persistent sense of being unclean or unhygienic despite regular washing, creating social anxiety and withdrawal. Perhaps most significantly, ongoing discomfort creates a negative association with the genital region, making men less likely to perform regular self-examinations or seek medical attention for more serious conditions. The solution requires simple adjustments tailored to aging physiology. Loose-fitting cotton boxers or boxer briefs with minimal elastic provide necessary support without restriction or overheating. For men with increased sweating or incontinence concerns, Moisture-wicking fabrics specifically designed for sensitive skin offer better protection than traditional materials. During sleep, wearing no undergarments allows maximum airflow and temperature regulation, supporting both genital health and nocturnal erections essential for tissue maintenance. Changing undergarments twice daily, rather than the standard, once provides significant reduction in bacterial load for men with recurrent infections. While proper clothing creates an optimal external environment for penile health, internal hydration status plays an equally important role, often overlooked by elderly men. How you hydrate your body directly affects the health, appearance, and function of your most sensitive tissues, creating either a foundation for vitality or accelerating age-related decline. Would you consider yourself properly hydrated right now? For most men over 65, the honest answer would be no, and this seemingly minor oversight has profound implications for penile health. The 10th essential care involves proper nutrition and hydration, elements so fundamental they're often completely overlooked in discussions of sexual health. Laboratory studies reveal a direct correlation between hydration status and the elasticity, appearance, and function of penile tissue that few men recognize until problems develop. Nutritional analysis of men seeking treatment for erectile difficulties reveals striking patterns. According to research published in the Journal of Sexual Medicine, approximately 62% of men with moderate to severe erectile dysfunction show measurable deficiencies in key nutrients that support vascular health, particularly zinc, vitamin D, omega-3 fatty acids, and antioxidants. This nutritional gap is especially prevalent among men over 65, who often experience reduced appetite, altered taste perception, and decreased nutrient absorption as part of normal aging. The physiological mechanisms connecting nutrition to penile health operate primarily through three pathways: vascular integrity, hormone production, and inflammation regulation. Nitric oxide, the molecule essential for initiating and maintaining erections, requires specific amino acids and antioxidants for synthesis and stability. Testosterone production depends on adequate cholesterol, zinc, vitamin D, and B vitamins. Meanwhile, chronic inflammation accelerated by poor dietary choices directly damages endothelial tissue in penile blood vessels, creating progressive restriction in blood flow that manifests as diminished erectile capacity. The physical consequences extend throughout the body but often appear first in erectile function. Chronic dehydration increases blood viscosity, reducing flow through the small diameter vessels of the penis and compromising tissue elasticity. Nutritional deficiencies in collagen-supporting nutrients like vitamin C contribute to loss of skin elasticity and tissue integrity. Perhaps most significantly, diets high in processed foods and low in protective phytonutrients accelerate atherosclerotic plaque formation in penile arteries, a process that can reduce arterial flow by up to 70% before becoming symptomatic in larger vessels like coronary arteries. The emotional impact centers on the preventable nature of this decline. In follow-up consultations, men who implement nutritional interventions frequently express frustration about previous healthcare interactions that never addressed these fundamental factors. Many report a sense of lost time and opportunity, particularly when simple dietary adjustments yield noticeable improvements within weeks. This realization often triggers reflection on other aspects of preventive health that may have been neglected, creating either motivation for broader lifestyle changes or regret about previous choices. Effective nutritional support requires age-specific considerations. Hydration needs for elderly men typically require 2 to 3 liters daily, with emphasis on consistent intake throughout the day, rather than large volumes at once. Diet should emphasize foods rich in L-arginine, pumpkin seeds, walnuts, salmon, and L-citrulline, watermelon, dark chocolate, pomegranate, amino acids that directly support nitric oxide production. Antioxidant-rich berries protect vascular tissue from oxidative damage. Mediterranean-style eating patterns, which naturally incorporate these elements while limiting inflammatory foods, consistently show the strongest association with preserved erectile function in long-term studies. While these nutritional approaches provide essential self-care foundations, they cannot replace appropriate medical care when problems develop. Perhaps the most dangerous care mistake elderly men make involves delaying or avoiding professional consultation due to embarrassment or resignation, a pattern that transforms manageable conditions into permanent impairments with far-reaching consequences. Medical records reveal a sobering statistic. On average, elderly men delay seeking help for penile health concerns for 26 months after first noticing symptoms, more than 3 times longer than the delay for comparable non-genital health issues. This final essential care addresses perhaps the most dangerous mistake, allowing embarrassment to prevent timely medical consultation. In 35 years of practice, I've witnessed countless cases where treatable conditions progressed to irreversible damage simply because pride or discomfort prevented a simple conversation. Healthcare utilization studies consistently show that men over 65 are significantly less likely to discuss genital health concerns than any other medical issue, even during routine examinations. This communication gap widens further as the severity of symptoms increases, a paradoxical relationship where increased need correlates with decreased willingness to seek help. Cultural messaging suggesting that sexual decline is an inevitable part of aging reinforces this harmful pattern, creating a self-fulfilling prophecy as treatable conditions remain unaddressed. The medical implications of delayed care are clear and well documented in literature. Many penile health conditions follow predictable progression timelines, with clearly defined windows for effective intervention. Peyronie's disease, for example, responds well to conservative treatments during the acute inflammatory phase, typically the first 3 to 6 months, but becomes resistant to non-surgical approaches once plaque calcification occurs. Similarly, erectile dysfunction initially caused by treatable vascular inflammation can progress to permanent fibrosis when left unaddressed, transitioning from a reversible condition to one requiring mechanical intervention. The physical consequences of this avoidance pattern prove both severe and unnecessary. Conditions that might have resolved with simple medication or lifestyle adjustments progress to requiring surgical interventions with higher complication rates. Infections that could have been cleared with oral antibiotics advance to systemic involvement requiring hospitalization. Most tragically, early-stage penile cancers, highly curable when identified promptly, spread beyond the possibility of tissue-sparing approaches when detection is delayed. The common thread connecting these outcomes is their preventability with timely intervention. The emotional aftermath I observe in men who finally seek treatment after prolonged delay consistently includes profound regret. Many express not just disappointment about diminished function, but deep remorse about the impact on their relationships and quality of life during the period of avoidance. Some describe years spent withdrawing from intimacy rather than acknowledging problems, creating distance in relationships that persists even after physical issues are addressed. Others report depression and social isolation stemming from untreated conditions that affected their sense of self-worth and masculine identity, psychological impacts that often prove more difficult to resolve than the original physical concerns. The solution requires both practical strategies and psychological reframing. Finding the right healthcare provider remains essential, ideally a urologist with geriatric specialization who demonstrates comfort discussing sensitive topics. Preparing for appointments by writing down symptoms and concerns beforehand helps overcome in-the-moment embarrassment. Bringing a trusted partner can provide both emotional support and additional perspective. Perhaps most importantly, Reframing genital health as a component of overall wellness rather than a separate category helps normalize these discussions as part of routine healthcare. Throughout these chapters, we've examined 10 essential aspects of penile care that too many elderly men overlook, from basic hygiene to psychological well-being, from clothing choices to timely medical consultation. The connecting thread remains dignity, not just preserving function, but honoring this part of your body with the same respect and attention you give to your heart, your brain, or any other vital system. Your sexual health doesn't define your worth, but it profoundly affects your quality of life, your relationships, and your sense of self. By implementing these practices, you're not just maintaining physical function, you're affirming that aging doesn't diminish your right to completeness, to pleasure, and to the dignity of proper care. This isn't about chasing youth. It's about honoring the body you have today with the wisdom you've earned through a lifetime.